And recording is on.
Good.
I am going to
For
change
Cecily.
mine to speaker view so that when this, it'll make the speaker big for purposes of putting it up on YouTube later. So they don't see the gallery the whole time. They can see who's speaking is most of the screen on the video that'll show up on YouTube.
Okay.
Something I should have realized when we first did it. I wasn't that damn smart. So, but we are
Who
now in
is-
speaker view. So my
who is that?
recording will be more friendly for when we post it.
Very good. Who is that from, that pretty lady from Cypress Hospice?
It should be Jen.
Jen Lou.
Oh, okay. Hi, Jen. There's Sherry. Hi, Sherry. How are you?
Laura's
Cindy,
there.
hi.
Well, Laura was
Laura.
there.
And
Yeah,
this
she
is how
was. She
rumors
was-
get started. Roberta's got the
Everybody.
house of Jen is what's going on now.
I see Justine is joining us from Cedar Hill. Yeah,
Oh, good. Great.
Kathy.
Oh, I didn't think she
Okay.
was going to be able to.
I know.
Hi,
Hi,
Hi, Justine.
Kathy.
Hey, Kathy. How are you?
I'm good. How's everybody?
Peach.
Okay. Yeah. Hi, Roman. I need your help.
Who, me? My
Uh,
help?
Yours too, but
Roman.
I was talking to Roman. Yeah, you should see my basement. I definitely need your help too.
Justine, do
That's
you
what
want to
I was just
unmute?
doing before I
please?
got on the call, my basement. Oh, my gosh.
Hey, I need that too, you know.
Yeah.
It's that time of year and we're all like, oh, okay.
It's the
Spring.
Yeah.
move. It's the moving.
Yeah, I
Justine.
feel sorry for you. Yeah.
Thank
Justine,
you.
you're muted. Just wanted to say hi and I'm glad that you're here. Thank you.
Hello.
Hi, Justine. Welcome.
Hey, Justine.
I'm glad we're able to make it.
Roberta, do you want to reach out to our other panel, Cecily, to see?
I will try that. Yep.
Okay, thank you. So, so while we're waiting for our panelists to jump on, I'm going to ask everyone to say the name of their business and specifically what they do in the business. So just basically
Livestock Clinical.
two words of introduction. So I'm
Yes.
Shalom from Right at Home.
I was just about to call you.
Oh,
And I do some of the, well, I'm basically the owner. So I do some of a lot of the supporting of our caregivers. And right next to me is,
I'm Nancy.
Take
I'm the recruiter. Oh,
Hang on just a second. Cecily's trying to get in, doesn't have the link. Salome, can you send the link to her, please? Or Jim?
I'd be happy to. So anyway, that was Nancy who was introducing. Okay, if everybody else would like to say who they are, Melinda, Roman, Laura, Jen.
So I'm Melinda Smith. I am Director of Business Development and Operations for Rent a Daughter, which is a non-skilled home care. So we provide home care in your home or wherever your home may be. So we also service communities. Roman?
My name is Roman Weinstock, Peace and Balance Reiki Center, working with individuals focusing on pain management, cancer patient, and terminally ill, but also working with different companies to improve their retention, reduce stress, and work out between employees.
Hi, I'm Laura Chernauskas from Arden Courts of Chagrin Falls. We are a memory care community for Alzheimer's and all different types of dementia.
hi, I'm Kathy McCarsky. I'm with Smooth Transitions. I am the marketing consultant for them. We downsize, declutter, pack, unpack, make the next home a smooth move to your next home. So thank you.
I'm Jen Liu. I'm the Community Relations Director for Cypress Hospice East. Our office space is in Willoughby. We're family owned and operated hospice providers.
Kathy, Jim, Sherry, John. Want to say who you are?
Yeah, this is John Goulas. I'm with Amada Senior Care. And for those that don't know, Amada is Spanish for beloved. It's not Amanda, it's Amada. We do non-medical home care, and we kind of specialize in trying to help individuals who have long-term care insurance actually get their claims filed and processed.
And I'm Sherry Gordon with 180 Medical, Senior Incontinence Specialist, serving individuals with Medicaid who are in need of incontinence supplies. And a shout out to Cicely. Hello, because I'm a WIT grad and And it's a great program. I'm sure she'll tell you all about it. You know, I thought of you immediately, Cicely, when they were looking for somebody for the panel. So thank you for joining.
This is Jim Kaler, the Kaler Law Firm. I provide legal help and with the help of others like Roberta Brofman, care coordination and oversight for people who need long-term care and people who have special needs.
Cindy, you want to jump on and introduce yourself? Roberta, Cecily, Justine, if you want to introduce yourself as our panelists.
Hey, good morning, everyone. Almost afternoon here. Cindy Cardwell. I'm the owner of Caring Senior Choices. So I assist families with either finding assisted living, independent living, memory care, and also work with individuals who would like to age in place and helping them provide a safe home.
Roberta, you want to help to introduce our panelists as well, please, as yourself?
Sure. And just anybody who doesn't know me, I'm Roberta Brofman, and I am a registered nurse. I have a company called 5-Star Clinical Solutions, and we provide expert clinical consultation to post-acute care facilities. And also we empower patients and people to get the best possible care they can. Let me admit Lee Jackson here. There we go. So we know that recruitment and retention has been an ongoing subject for this group for discussion since its inception of the group. And of course, COVID has placed a new challenge and a new spin on recruitment and retention in the past year. And looks like COVID isn't really settling down as much as we'd like it to be. So we have two panelists with us today. And Justine, I'm going to have you introduce yourself a little bit more because it's a wonderful surprise that you're able to be with us today. I didn't think you were going to be able to. But first, allow me to introduce Cecily Campbell. She's the Director of Women and Transition, the WIT program for Cuyahoga Community College, Tri-C. She joined Tri-C initially as a volunteer for the WIT program. And because of her expertise, she quickly climbed the ranks to become the director of the college-wide grant program in 2012. She received her bachelor's degree from Vanderbilt University, where she studied human and organizational development. Later went on to earn her master's degree in social work with a concentration in social and economic development from George Warren Brown School of Social Work in Washington University, St. Louis. She's a Cleveland native and has traveled around, done a lot of work in different cities. However, she's passionate about helping the community here in Cleveland, so we're glad that she's back with us. She states that her two greatest accomplishments, I think this is just great, are making her late mother, Linda, proud of her, and also being the mother of the best son in the world, Jackson. So welcome, Cecily, and thank you for being here with us. And then we have Justine Walker. And Justine, I believe you are from Cedarwood Plaza, am I correct?
Correct.
And you are in human resources, right? And I apologize, I don't have your bio. I didn't think you were going to be with us, but thank you so much. I'm so glad you were able to be with us. So go ahead and introduce
It was last minute that we made some time.
Good. I'm glad to hear. I'm glad you were able to do that. So we do have a set of questions that were sent out. Justine, I hope you received that. Cecily, I believe you did. So if everybody else would go ahead and mute yourselves except for Cecily and Justine, and we'll go ahead with our questions.
I'll be honest, there's a number of them that I will not have answers for, as I'm really new in the healthcare industry.
We will not hold you to it. We just
We don't
love
hold that
that you
against
have
you.
jumped in, and you've basically got a baptism by fire, and you can
Right.
see you can see what we're all working with.
Yeah. And you know what, Justine, if we all had the answers to all these questions, we wouldn't have to have the panel discussion, right?
Right.
So, all right. So the first question has to do with whether or not we're placing our emphasis and our focus on with recruitment and retention on the right things. Should we be looking at education and non-college options for success? You know, we have tended in the last 20, 40 years to focus solely on people getting a college degree. And there has been some shift with the previous administration to put more money into, you know, trade schools and things like that. So Cecily and Justine, whoever wants to take that first, and Cecily, remember you're muted still, so, okay. So go ahead.
I'll jump in as well. And I agree that a lot of focus and, you know, especially when kids are coming out of high school, we're saying, go to college, go to college, go to college. I think a more appropriate tagline would be get a credential. So that might mean a college degree, but it might also mean like a short-term certificate in some field. The more that I'm working with CTE, so career technical education, the more I'm learning is that these career technical, well, you know, formerly called vocational, right? Those kids or those individuals, they actually have the skill set to go along with the education. Sometimes when we focus solely on the college degree, those individuals don't necessarily have the experience.
Thank you for saying that, Cecily. So important in healthcare. Like when I'm hiring, I don't care what's on the piece of paper, but if you have the patience to deal with dementia, you're going to be a good part of my team.
Oh yeah, absolutely. So I mean, it's just about the experience and the passion. You can't teach passion. Somebody kind of has it or they don't have it. So that would kind of be my takeaway. So sure, yes, we all get excited when people say, you know, what their degrees are, where they're from. I went to Vanderbilt. Vanderbilt's a big name in Nashville, not necessarily in Cleveland or other parts of the country. So it doesn't necessarily matter where your degree is from, but I think it's more so if that person has a credential. So maybe even if it's just a short-term certificate, they completed a 6-week, 2-month, some type of training course. I think that makes them appropriate for the position as well.
Justine, you want to speak to what you think is more important, degree or experience or a mix?
I think it's a good mix. I agree that you should get the credentials in a sense and start working your way up in it.
Yeah. I was just on a cabin meeting with the college earlier this morning, and our president, Dr. Johnson, was just saying that we are going to start focusing more on a jobs first initiative. So not complete the degree and then look out to see what jobs are available, but what can we do or how can we help our students find pathways into a profession initially when they first start or walk onto the campus that first semester.
I love that initiative because it basically is going to focus also the teaching towards the professions. I mean, we have so many job openings right now, right here in Cleveland. I mean, I know in the manufacturing sector, just to take one outside of our industry, where companies could grow if they had employees. I mean, it's certainly true for my office.
Yeah, and just a personal experience, personal story, kind of on the subject matter. So sure, I initially chose gerontology as my only because my student advisor said it was I'll make a lot of money because people are retiring and they'll always need somebody in the field. However, it wasn't a good fit for me. I did an entire semester in gerontology. My grades were fine, but when I did my internship that first day, walking around with the social worker in the nursing home, and then we went back to her office to complete the paperwork. And then in my head, like an alarm went off. And she kind of said, oh, Miss So-and-so must have passed. We were expecting to be kind of like any time now. And I immediately realized that at that point in my life, I had no experience with death. So I knew that it wasn't the appropriate field for me. So I'm always telling people, like, you have to experience the work that you're going to be into, whether it's just, you know, volunteering or talking with somebody in the field first before you commit all of this money and paying student loans and being in student loan debt for the rest of your life.
You know, it's just like, I couldn't say it better than you just did. It's so sad when we see people who have spent a fortune and are knee deep or nose deep in loans, and then they get into the profession and realize this isn't what I really wanted. You know, it used to be that we spent a lot more time with people, sending high schoolers even, and even college students into the actual profession to see if they like that. And we don't do that so much. It kind of leads into the last question that I had on here, but not our last question, which is how the education of aspiring healthcare workers has changed in the past 5 to 10 years, and why have these changes been implemented?
We'll let Justine take a stab at that.
Go ahead, Justine.
I'm sorry, I did not hear the question, but I do have a comment on it. We here at Cedarwood, we offer like an incentive for those to go back to increase their knowledge and get a higher certifications. And so we push for them to grow in general, which we're hoping will make us grow in general.
Yeah, I think that's fantastic. There's, I have in my career, and I still do this for some of my clients, created what I call a clinical ladder program. So we have incentives at each level so that, let's say you're an aide and you want to become a nurse, you know, you want to become an LPN or an RN, or you want to become a physician, then we help you go through educational programming that we pay for and incentivize you. And then you kind of climb that ladder. You get a little more incentive and you get some reward as far as financial payment. And then of course we support you through your career. And it's a win-win because the organization wins because they have a great employee that knows your organization. And also, you know, that individual is incentivized. Sometimes I feel like some of these entry-level positions, people feel they're stuck there and there's no incentive for them to move forward, or maybe financially they can't do it. So I think those are.
I love looking around so we're all caregivers, but I love looking around to see that everybody who's here has moved up, you know, into the management roles from being caregivers. But to Cecily's point, sometimes it does take more training to be able to feel confident, for example, as a manager.
Yes.
Well,
Well, you know,
I'm sorry, Roberta, but even if even if you're recruiting people to come in, which is basically what we're talking about, I think to Cecily's point that, you know, I now have worked in 3 or 4 different areas in the senior field. And you do have to have a certain type of personality. I could see the staff differences that she talked about. You knew from the minute somebody came in if they're staying or leaving, because they just didn't have that. They didn't have that feel. It's not that they were bad people. It's not that they couldn't probably technically do the job. They don't want to do the job. And they move on. And I know in her program, because we've known each other for a while and we haven't seen each other for a while, that you have people from different walks of life coming into this transition program. Many of them are older, which is kind of a nice thing, because I think that they're a little more grounded on what they know about themselves and what they think that they can do. And Sherry said she was part of that program, right? At one point. And I know our club has supported that program for that exact reason, helping women find a way to get solid ground and do what they want to do. Do you find that most of your people coming in are older from a recruiting aspect for us to look at your?
Yeah, so again, we're adult serving program, so that's 18. Oldest graduate was 91, but our
91
is late 40s, 50s. Because exactly what you said, Melinda, regarding that lived experience. You know, just going through life, going through the different stages, and somehow just feeling stuck and not really sure of how to move forward or where to move forward. And some, you know, sometimes it's just like stuck in their ways. So, or it's kind of just stuck. I help everybody else, but I don't know how to necessarily help myself.
I have a question. This is Kathy Makarsky. Are there like programs in vocational schools that kids can kind of see if they would like this? I mean, I have a niece whose daughter is like such a compassionate personality, and it's like, you know what? She is in the senior world now after she graduated, but I'm wondering if they can get a feel for it to see if maybe it's something they would like to get into. And then I will say too, some of the best caregivers and aides that were at Royalton Woods, where my mom and mother-in-law were actually going to be nurses. So they were so good. And it's almost like you want to see more of that kind, like, hey, let's look at these personalities, make sure they love what they're doing, and show them, you know what, you can go do something else, and you know, whatever you want to do, you don't have to just do this. Not that it's just, because believe me, I praise them, these young people who do this, but just curious about any kind of things like that.
Yeah, absolutely. So there are high-tech programs throughout the state. And there's kind of like 23 career clusters. So most students kind of get involved their junior or senior year, and they can actually earn college credit in these courses.
Oh, cool.
So I know there's a consortium at Mayfield High School is a really big one. There's also one called Tri-High, which is Cleveland Heights, Warrensville Heights, and I can't even think of the other heights. But yeah, there are opportunities. There's tech. Oh, I'm sorry, I said high tech. That's wrong. I have so many different programs in my unit. There's tech. That's what I'm trying to say. Tech prep. Also CTE and the high school level. So the K through 12 secondary education. And there's again 23 different career clusters throughout the 23 different career clusters. Healthcare definitely being one of them. So yeah, they work with professionals in the field. The place you might want to recruit is the name will come to me, like Polaris. Like
Oh, yeah, absolutely.
Different things like that too. One thing I was going to say about last question, has the education of aspiring healthcare workers changed in the past? I might be sharing Tri-C secrets, but I think it was fairly public. Our nursing program was under scrutiny maybe 7 years ago, because not all of the professors, I think, had their certifications. So with that, and the state has changed how they're awarding financial aid to institutions. So we had to streamline our programs, meaning all of our Tri-C students have to complete their math and sciences first, which in healthcare, you definitely need math and science. But that weeded out a lot of people because a lot of people were completing all of their coursework and leaving their math and science to the very end and unable to pass their math and science. So that might be some of the reasons why maybe you're not seeing as many, just because they may be struggling with those math and science requirements.
Yeah, it's probably good to get that all out of the way first so you can pass that first hurdle. You kind of bring up something that's one of my pet peeves, and that is that I've been a nurse for more years than I care to even admit, and I have a bachelor's and I'm a registered nurse, a bachelor's of science in nursing, and I also have an MBA and specialized in healthcare management. Now, I am not allowed by the regulations to teach at a college level. I can't even teach in an associate degree level for RNs, which to me is crazy. So I can have, and I have nothing against these folks, but let's say I'm a nurse and I have no experience and I go right straight through from my RN, BSN, master's degree in nursing, and then I'm able to go teach, right, at a college level, but I have zero experience. I've never worked before. To me, that seems really foolish. And they're really struggling to find professors, to find people that can teach at the college level. And they're turning away applicants left and right. And we have such a huge shortage of nurses and healthcare professionals. So it just seems so foolish to me that they won't change that. If I have a master's in healthcare management and I have all this experience, why? And if you want to have somebody supervise me, that's fine. But how silly, especially since we have many nurses who have retired early, don't want to work on a unit. That's just great wisdom and experience that we could tap. So that's just one of my pet peeves. One of the things you all mentioned was alluded to leadership. And this is one of my things that I think is so critically important. Question 6 says, leadership is proven again and again to be a key in employee satisfaction and retention. Why do so few organizations invest in leadership? As we know, people leave their managers, not the organization. And we don't seem to teach that in school. Cecily or Justine, do either your programs or your organizations focus at all on leadership training? I call it proof you're a manager syndrome, right? You're a good nurse or you're a good whatever manager or a good business person. So we put you in a management leadership role, and that doesn't always work.
Currently not that I'm aware of that we have anything like that here at Cedarwood. We do have promote from within. So, I mean, I've known a number of people here who started out in the industry. For instance, our scheduler, she started out at an entry-level SDNA. She now works directly under our DON, and she does just about everything in regards to hiring and scheduling every single one of the nurses. So, I mean, we do some sort of teaching, but I'm not sure that it's a general
Yeah, so in other words,
move
she
up.
got promoted and worked her way up through the ranks, but I guess
Correct.
what I have found, and I know this happened to me, you know, I was recognized as being a good nurse and all this kind of stuff. And they said, hey, we'd like you to be the director of nursing. And they just dropped me off at the desk in my office and gave me a phone list and said, see, not that they didn't provide any support, but there was no leadership training. I mean, when I had disciplinary issues or hiring issues, I had to kind of work my way through figuring out how to manage those kinds of conflicts and those issues. I mean, I do like a full day and half day seminars on leadership training, and sometimes I just feel that people don't really realize how critically important leadership is. I just wondered if you guys teach it.
We do. Tri-C is a nonprofit institution or organization. We are not, I mean, obviously everyone's concerned about the bottom line and the profit, but that's not necessarily our main focus. And we do a lot of hiring from within as well. So it's not necessarily a requirement. However, we do have a pretty robust tech system where it's all about professional development and professional development opportunities. As we're talking, I will find the link because like our corporate college, our corporate colleges is all about professional development. And through COVID, they've offered a lot of free webinars to just kind of help individuals, as well as if you're aware of our, I'm just a loss of words, but we have a program for small business owners that they're always recruiting for. SACS something, but I will make sure to find that link as well because that's always good.
The Goldman Sachs?
Goldman Sachs, yeah.
Okay.
It's a program geared towards small business owners.
I know a number of people who've gone through that, Cecily, and the peer mentoring from that program is quite strong. Like from Right at Home, like we call it home improvement, but our annual convention this year, the conference will be online like it was last year. And we're getting ready for different, of our staff training modules. And to Roberta's point, I'm going to jump ahead also to question 7, Roberta.
Purvis has his hand up, I noticed.
Oh, okay.
Yeah, I'm sorry. I wanted to chime in, and I apologize. I joined the call a little late here, but I wanted to chime in with a thought that I think complements the recruitment and retention idea. This is perhaps geared more so towards the management or the decision-making group at all of your different firms. I deal with financial planning, and I work with a number of businesses where they're always looking for creative ways to recruit, retain, reward some of their key employees or competitors' employees for that matter that they're trying to recruit away. So I just want to share with you, a high-level overview idea of there are some very creative ways you can take advantage of, financial tools that somebody like me or whoever you work with could point you or those decision makers in a direction of. One example I can give you guys was with actually a home healthcare company out of North Canton. The owner and the business operator, she had a key manager and she had 25 caregivers, and she was looking for ways to reward them and retain them even more on a financial basis. She had put together a 401k plan, and she was looking to be a little more selective with who she rewarded and how she rewarded them. So without going into great details, there are some really, really nice tools that, those decision makers could bring to the business owners, or you can think about if you are in that decision-making role to say, okay, do I talk to somebody like Irvis that could tell me about these creative ideas where I can maybe do a carve out of 2 or 3 key persons, or if I can build a benefits package that's above and beyond, the salary or the hourly wage that I'm going to pay, somebody I'm looking to recruit from a competitor. And that's, what 2 cents I had to share on the topic, but I think it could do very well for you guys to keep that in mind, because there are some really neat ways that you can recruit, retain, and reward some of your better employees.
I think you make a good point, Irvis. I had a client that brought me in to look at recruitment and retention, and we did make a dent in turning around their turnover rate, which is extremely costly. But one of the biggest reasons that their employees kept leaving was because of the benefit package. They couldn't afford a better benefit package. And quite frankly, people need, the hospitalization and medical care and that sort of thing. And that was just a barrier we couldn't break. And they just didn't have the financial wherewithal to change that. So your point is well taken.
Before you leave this topic, Cicely,
Yeah.
with your people that you have in your program, with your group, what do you feel is something that they want as a reward? Because it's fine to say we have all these ideas, but unless it matters to that particular group, or in our case, our caregivers, then it means nothing, right? And many times caregivers will leave for 50 cents more an hour or $1 more an hour. So yes, money is important, but it isn't all about the money. So, and again, you have an age group where they are looking at it, they are less likely to jump at 40 or 50 than they are at 20 to another job. So what do you feel is a good reward system? Just some ideas, because that's part of what we're doing, right? Recruiting and retaining.
Sure.
So.
And I'll speak in regards to like how I lead my team as well, because my team, when I became director, I was the youngest person on my team. I might have like 1 or 2 now younger than me, but the majority of my team is still older than me. And the majority of my team is part-time. And when I say they're like dedicated and committed to this work, they're very passionate. This is definitely a labor of love. So our part-time members, the college really has also like just made it so you can't work over 20 hours. So they are volunteering at least 5 to 10 hours each week, and they have no issue with it. And I think some of the things that we do, like at our team meetings, now they're all virtual. We open up 15 minutes earlier just to talk. Nothing about the job, more so about our families. Like I know every person's on my team, I know their children by their name. For those, when they might have to call off or be late, I always say my key line is no worries. And they recognized me a little bit while ago. And they just said, just that simple phrase, how you always say no worries, really makes a big impact. And their commitment level, not just to our program, but to me as well. Birthday recognition. I have my birthday list of every person on my team, and I put it on my calendar when that person's birthday is. And initially, out of my pocket, I was dumping like $10 into their Tri-C card for snacks, right, for their birthday. Well, we're not on campus anymore. So now I'm like, well, I can send you Amazon card, Starbucks, Chick-fil-A. So basically the apps that I have on my phone, I can now send you an e-gift card. So I do that for my team members, but I really make it personable. So I understand that they have lives as well. So when they're a caretaker and they might need to flex their schedule because they're caretaking for someone in their personal life, again, it's no worries, let me know in that regard. So I think because we serve women in transition, but if we're honest, we're all women in transition as well. We all have our personal lives. And they get the work done. So I found people who are really passionate about this work. So I don't have to worry about whether or not they're reporting to work or whether or not they're doing the work or attending to their students. They're all doing the work, but I make it personable. So we're really a family. And then with the women we serve, we're really a family as well. We go to bat for them behind the door. So if they're having like an enrollment issue with the college and someone at the front window said, well, no, because you owe the college money. You know, they'll bring it to us. We'll have backdoor conversations with the director of the enrollment or with the counselor or with the dean and really like go to bat for our women. So I think that's one way. Another example is just, so the college, more than likely, everybody's getting vaccinated now. So they're dropping hints that we'll be returning to campus pretty soon. So we had to kind of develop a work plan. And instead of me saying, okay, you two are going to work on Monday, Tuesday, you two are going to work on Wednesday, Thursday, I went down the line with each team member and I asked, which day do you want to come back? In your ideal world, which day would you want to come back? I can't guarantee that you'll get to come back those days, but we can at least have the initial conversation. So I think
Cicely, what you're saying is just like right out of textbook as far as great leadership. You know, you are connecting with the people that you lead. You are passionate about what you do. It's coming from your heart, and you can't fake that, right? So the ideas that you come up with truly stem from not just a book you read or, you know, some paper or some discussion, but rather from putting yourself in their place, identifying with what they're going through and helping them through that, which is really true great leadership, right?
Yeah,
So,
and then again,
bravo.
like I worked my, thank you for that. I worked my way through the program. So I've been at every step. So also to this day, it's no issue for me to fill in for somebody if they need some time or if they're going to be late. I make my own copies, you know, all the little stuff. There really is no I in team. I do everything. We don't sweep the floors, but if there's a vacuum that needs to happen or something, I'll do it. I'll carry the boxes, like whatever the case is. And I think it's important for your team and your employees to see that. And the one thing that really resonated with my team is honestly, when I ask about their kids, when I know their kids by name and I ask about their kids or their significant other, that seems to really resonate.
What's your husband's name?
You actually care, right? So again, that comes from your heart and you can't fake that. You remind me of a time when I first became a director of nursing and I had come from the home care department and I truly cared about the patients. You know, that was why I do what I do. And I was walking by a call light and I knocked on the door, answered, it was a patient room, and there was an aide in there and there was kind of a mess she was cleaning up without getting into details. And so I went back out and I got some gloves and some chucks and, whatever we needed. And she looked at me when I came back in, she goes, "What are you doing?" I said, "Well, aren't we going to help clean her up?" And she goes, "Where did you come from?" And I just thought it was really a moment that changed the way that the staff saw me, right? Because it wasn't that I was going to sit in an office and everybody else do what I tell you to do. I really cared about the residents. And I believe that it is an honor for us to be able to do what we are able to do. And that comes from my heart. And they saw that. And the whole unit really, it was a unit that was a mess when I got there. It really turned around because they got behind me and I made sure I went to bat for them in so many different ways. So that, like, to your point, Cicely, I think that you have to demonstrate, not just talk, but demonstrate what you're willing to do. And honestly, if I worked for you, I'd never leave you. I mean, you care about me. Why would I leave? I mean, right? So again, I think that's great advice. Great advice.
Yeah, and I care about their professional.
I want to bring Justine on.
Yes.
Justine, would you like to chime in? you wanted to talk about leadership.
Yes. I mean, our leaders, they do take a personal approach with every single one of our employees. I have as well with people who have come in and asked me questions, asked like, how do I do this for, let's say, FMLA? And the person who was here before me wasn't as friendly or didn't take a personal approach. And I've had so many compliments on just how nice I've been and how helpful. And I believe that in me doing that, our leaders here are also taking more of a personal approach. So I think it's infectious.
Great. Wonderful.
I wanted to move to number
Go ahead.
7, Roberta.
Sure. Yes.
On accountability.
Yes, this is one of the things that I see frequently. So you can have a great leader that doesn't hold people accountable. So I believe that accountability is critical to achieving consistent performance and leading to quality. So can you talk about leadership accountability and how that ties into success?
So the program, so Tri-C is 4 different campuses. We have a Women in Transition program on each campus. One thing when I came in, I made sure we had a baseline model. So we have baseline curriculum. So everybody's doing the same exact thing. Everybody's having classes at the same exact time. So that kind of helps with our accountability because we have there is a set standard. So as long as we have that set standard, there's not much deviation. I guess sometimes you can add in your own little spices so you can maybe teach it in the way that caters to you or to your teaching style, but there is still a set curriculum that we all have input in, not just our student advisors who are our actual lecturers, but our program assistants as well. We come back after every semester to say, hey, what worked, what didn't work. Just the other day, our student advisors want to change some things again, so they're requesting a meeting. And I said, okay, we'll discuss it at our next full team meeting. And they said, oh no, this is just us. We don't really need the program assistants. I'm like, no, we need their input as well. So they need to at least be aware of what we're potentially going to do, what we're potentially going to change or move the program. And we need their input. So then we can at least have their input, make the decisions based on their input as well, not just make decisions and then come to them at the tail end of it and say, well, what do you think after that? So from the drawing board, we're asking everybody who is part of the team, and I use the word team a lot more than I do class. Also, I just have an athletic background, so maybe it comes from that. But I definitely use the word team a lot more. And again, and another thing I do too, every time I introduce myself, I say I have the pleasure of serving as the Director of Women in Transition, just so that everyone knows that I am part of the service as well. I am providing a service to our community as well.
Yeah, that's fantastic. I think one of the things I hear often from people is they correlate accountability with discipline, and they correlate discipline for something negative. And I think one of the things I teach in our leadership program is that, first of all, a person has to know what's required of them, right? So maybe I wasn't clear in letting you know that I expected you to get to work at 7:30 in the morning, not 7:45, and that wasn't negotiable or flexible. And then after that, I think Simon Sinek, who's a great speaker on leadership, writer on leadership, talks about if you had a kid who was failing in school, would you tell him you're out of the family? No, you wouldn't, right? You'd say, well, what's the problem? What's going on? Are you having some challenges? Are there problems? Sitting down with an employee and saying, hey, I noticed you're showing up at 7:45 instead of 7:30. Talk to me. Is there something I can help you with? Is something going wrong in your life? And I think, women in transition, that's probably a place where you have those kinds of discussions, because we all have lives and we all have challenges. I don't care how great our life looks from the outside. Everybody has something going on. So maybe it's something that you can say, okay, for this month, you're going to come in at 7:45 because you have some childcare issues. Of course, there's people who just flaunt the rules, and then that's a different story. You've given them a warning and you have to move on. But I think accountability is so important, because the people who are doing things the right way are watching what you're doing. And if you're not holding others accountable who are not following the rules, one of two things happens. Those good people are going to go elsewhere because they feel they're not respected and valued for the good work they're doing, or they're going to become the same, show up late, not care, because apparently no one cares here, right? So, I've seen this time and time again, where you have people who are good leaders and have great ideas, but then they don't hold people accountable. So, I think, it's really critical. Justine, any comments on that?
I totally agree with you. Like I said earlier, it's what you're doing is infectious. Other people are going to adapt to what you're doing. So if you, in a sense, are holding yourself accountable, they're in a turn going to do the same, I believe.
Yeah.
Totally agree.
Add to that, I lost. Oh, so I definitely don't micromanage. I've had to have conversations regarding performance, and you can see it change. And if it and again, like you said, it's not just saying, well, you're late. Like I have colleagues who's literally stood at the door and just slid a disciplinary sheet to their employer and saying, strike one. That employee is now on my team because she couldn't wait till I had a position open. So again, and even that day when I witnessed it happen, the employee, her director was gone after that. So now I'm asking, what happened? Why were you late? And I got the full story. She was having car issues that day. She had been up since 6 a.m. Like, if her director kind of just knew all of the background story. And I think it's also important to know that people in this field, they're personally connected somehow. So they want to help because somewhere down the line, someone helped them. So if we can kind of just pull on their personal aspects of why they do this work, they'll, I think, be more dedicated to the work versus kind of just disciplining them, because that goes.
So true. So true. There's a line that great leaders make the people around them better, right? That's the whole point of leadership, is not to make yourself better, but to make the people around you shine. So that's exactly what you're referring to.
Roberta, I have a quick question for
Sure.
either Justine or Cicely.
Yeah.
So do you have suggestions when you have a large group? So in the home care industry, Shalom and John and myself with Rent-A-Daughter, we have 25, 30, 40, 50, 60 people that go out and do caregiving on any given time. If they're late, if they don't show up, it's a domino effect, right? Somebody else has to wait, or the person doesn't get the care. And if they need care when they need their care, that's a problem. So do you have a suggestion on getting that accountability in that group? I mean, things happen for sure. You get into a car accident, or your mother goes to the hospital, and so you have to go. And we make allowances for proven things like that. But if somebody's just late, it's domino effect. So do you have a suggestion on how to work with those individuals? Obviously, they get some sort of discipline for it. They get a conversation or whatever, but that would make them be more likely not to do that again without, you don't want to jump down their throat, but you need them there. So Do you have any
I'll
thoughts?
say with Cedarwood, we have an incentive program through OnShift where they collect points. So they get points for working their scheduled shift. We obviously recognize that not everybody's going to be on time. I think we have a 7-minute window to clock in after your scheduled shift and still earn your points. Once these points are accumulated, they can receive gift cards to various locations like Walmart, Target, gas card, Dunkin' Donuts. So, I mean, and it's incentivizing them to be there on time, work their shift, also pick up shifts. And I have them coming through my office every single day. I mean, it works to some extent, and it also means that our residents here are being taken care of in a timely manner.
I love the idea. I love that idea.
Yeah,
Thank you.
we've used OnShift before, and you know, I know they have that 7-minute window that always makes me laugh, because it's like, well, if somebody has to go to the bathroom and they try to get up and they fall, that's kind of a problem with your 7-minute window. But I think those, you know, incentivizing people is really good. I think one of my questions, Melinda, would be asking the individual, why were you late? So in other words, if I go to my doctor's office and my doctor comes in and says, this actually happened to me years ago, doctor was running late and he walks in and he says, hey, he called me Bert. He said, Bert, really sorry. He said, I had to have a difficult conversation with my last patient, just had a diagnosis of cancer. Now, he didn't tell me the name, but that certainly made me realize if he's going to take time with that individual, God forbid I need his time, that's why he was late. So let's say your previous client in home care, and I've done home care for years, falls, right? I can't leave. I can't just walk out the door. I need to provide that care for that individual. So I guess I would have the conversation with the employee as to, and start tracking, you know, why was that person late? Well, is it, well, you know, I stopped for gas and then my kid was this, and then, you know, there's 10,000 different little excuses. Then I'm kind of going, not so much, right?
Most of the time it is children, because many of our
Yeah.
caregivers are younger and they do have
Yeah.
children. And unfortunately, our seniors are kind of like children. They need you there when they need you there. So it's really a difficult thing for those of us who work in industry to be able, we want to reward people, but if they don't show up, and it happens frequently, even with the
that
child in
generation does not like 10 minutes late. They aren't into that. One of the things I used to say to my patients when I'd set up my appointments with them is I'd give them a window. So I'd say, I'll be there between 10 and 10:15, you know, and I always knew that the previous patient may have some issues that may take me a little bit longer. Maybe they're still getting out of the shower or something, you know, I don't know, whatever the case might be. But it gave me a little bit of a cushion so that next client wasn't upset that I was running behind. And the other thing is I call them, right? So I call my next client and say, hey, I'm running a little bit behind. Maybe they can do that. But I think after a while, you just have to say, and Cecily and Justine, I want to hear your comments, but after a while, you just have to say, this isn't working. You know, there's also, to Justine's point, in the opposite direction, not that I like punishment, but there are points that you can accrue for being late too, or for not showing,
so
you know. So you accrue those points, and you have a policy that's written that says after a certain number of points, you get a written warning, you get a suspension, and you're terminated, you know, and I hate to be that negative, but you have to also look at holding people accountable from that direction too. Cecily, any thoughts?
Yes. We do the same thing with the point system for negative and being late and whatnot. However, because of COVID and employee retention, we try to maybe do a shift change or just because it's really hard to let somebody go because they're consistently late, especially nowadays.
Yeah, but I will tell you again, you know, and this is just my pearls of wisdom, take them for what you will. It gets you in a lot of trouble, because what happens is the staff realizes that you'll do that. So they say, okay, they're not gonna terminate me because they need me. They can't find anybody else. So I'm going to show up as late as I want to show up. Yep, that's what happens. And again, it's that concept of, well, everybody else is doing it. So what's the difference? I'm going to be 10, 15 minutes late. Nobody got in trouble. They do those points, but they don't really do those points. It's just a joke. It's kind of like children when you say, you know, if you do that again, you're going to your room, and then the parent doesn't do it. You've lost a lot of credibility by doing that. And I get where we're at. I get it. That's the whole point of our conversation, right? Is that how do you find the next employee? Well, eventually you're going to find the good employees are going to stick with you. And you're, unfortunately, those that don't want to follow the rules are going to have to go. Cecily, thoughts?
I like to incentivize, but for me, it's just a quick email, you know, just to say, hey, thanks for being there today. You know, or even if you can gather some testimonials from your clients to then share with your employees, that might go a long way. Like it takes extra. It takes a lot of extra outside of your normal like work duties to grow your team. One thing I realized early on in one of my initial like professional development trainings, because this honestly is my first time having a team, that in an 8-hour day, I might have 2 hours that I can actually dedicate to my own work. And it's not 2 consecutive hours either. It might be 30 minutes at the beginning of the day, another hour or 15 minutes here and there, but literally only 2 hours to dedicate myself to what I actually need to do. So I just think in management, there's a lot of putting out fires. Some people, yes, you're going to have to just let go, but I don't know if you can, because I honestly can't speak to this. Okay, today it really was, I couldn't find the link, but I am not the most punctual person. So I honestly don't hold my team to that because, again, I'm going to lead by example, but I'm also going to stay a lot later. But I understand, because what you just said, in this field, you can't necessarily do that, but could there be some shift changes? Could they possibly work longer days and longer hours, fewer days? So can they, maybe add 2 hours on a day and then maybe only work 4 days out of 5 days? No idea what that will look like or stuff like that.
So we only have a couple minutes left. I wanted to give our panelists some appreciation for being with us. We are going to take some questions, and I saw John had his hand up just a second ago. And I did want to also mention we do have a date scheduled for next month. Melinda, do you want to mention something about the 29th, Thursday, the 29th of April at 11:30?
I'd love to say for sure we have Robert Smith. We had wanted him in February, and then there was a scheduling issue. I'm working on it.
Okay, so we don't.
I sent the email today and don't have the confirmation, but it's on motivational ways to work with your team.
So we will put out the topic, whether it's going to be on motivation or if it's on grieving. So let's bring on John. Do you want to address the question to Cicely or Justine?
Well, I think, I was just going to mention, in some businesses, there's the flexibility to move. In our business, and be a little more flexible with scheduling. But in our business, as Melinda and Shalom, as you know, it's practically impossible. My biggest question is what's causing the lack of candidates in caregiving? Is it lack of knowing that there's this business out there? Is there a lack of are there incentives or other things causing people to do to not want to be a caregiver?
So just to speak to John directly, and he's one of my lovely competitors, I would say that one of our challenges right now, I don't call it the W-2 flu, I call it the stimulus. There's just a lot of extra money bouncing around, which makes monetary incentives devalued. There seems to be some wage inflation in that going on as well, which isn't always a bad thing. But I would say that it's that our industry is getting to be better known, but it's still not super well known. But I would say that maybe even a bigger challenge is that we're not doing enough to train up the next generation. I think it's generational. I'm not sure that we're doing enough to train up the next generation of nurses.
Can I say,
Totally
I think
agree.
I think it's just hard work. So now that I am
Yes.
a caretaker, because I caretake for my grandfather just once a week with my aunts, it's hard work. He might curse at me. He wants the blinds opened at a certain time. He doesn't, he wants his coffee a certain way, his eggs a certain way. He has dementia now. It's hard work. And honestly, for not that much money,
That's right.
I think just professionally, we don't respect caregivers enough, or we don't praise them enough for the services that they do. I don't know how you combat that. I think you just constantly sing the praises of your team members and just let them know how valued they are, how appreciated they are, and then again, I feel like make them feel like family members. Also, I think for younger generations, everything's so quick and fast movement. They don't want to just, I don't know, this sounds bad, sit around and watch the judges with someone throughout the day, because they have so much, everything is just quick. And they don't necessarily value taking care of other people. It's all about what I can do and what I can have for myself. So somehow we have to change that mindset with younger individuals.
I think it's the difference in family situations. When I grew up, we knew our grandparents, we helped take care of our grandparents. You're taking care of your grandparents. You have a whole group of younger adults who are disjointed. They don't always know their extended family, nor do they have to ever watch anybody care for them.
Yeah.
And so they don't know how to do that. And that makes it, hard for them. As you pointed out, it is a hard job. I took care of my grandma. It's a hard, and I'm taking care of my mom now. It's a hard job, but you do it because you care about that person. And how do you translate that care? They spend a lot of time on their phone. I think that is our biggest dilemma when we put a young caregiver in, and the family will call us and say they sat on their phone the whole time. They don't engage with the person. And so, then we have to speak to them saying, look, you can't just sit on your cell phone. Yeah. And they do it, and they can be 25 or 30 years old and do that. They don't have to be 20.
A lot of what you guys are talking about is hiring for the same why. So again, I hate to bring up Simon Sinek again, but he talks about surrounding yourself with people who believe what you believe, right? Yeah, Kathy's going like this. So, if I hire somebody who really their motivation is they want a paycheck, and they're in the profession where they have to take care of the elderly, it is not going to work, right? I think the challenge for all of us is finding more people who really have that same passion about taking care of the elderly. Unfortunately, our society doesn't value the elderly. It's sad, but it's the truth. And also, to Cecily's point, we can go to Panera and make Panera sandwiches for more money than you can taking care of someone who's elderly. That it's backbreaking, it's frustrating, it's hard work. So you have to find people who truly this is their passion and their why, their belief, and surround yourself with those people. I truly believe that the decision you make to hire who you bring in your front door is the biggest decision you make in long-term care and post-acute care. It really is, in any organization, really, because you're going to spend so much time and trouble putting out the fires they create and dealing with their issues rather than taking more time to find the right people. There is a personality test. I can send it to all of you if you'd like.
Great.
That's a 15-minute personality test, and it ranks 5 different characteristics, some of which has to do with agreeableness, conscientiousness. So if I'm really lack conscientiousness and compassion, you don't want to hire me. So it may not be the only thing you use as a screening tool, but I think it might be a really important screening tool, and it's only a 15-minute little exam. So
I want to thank Roberta for being our moderator. I'm going to read to you a couple of the comments that came in through the chat. So I know some of the folks aren't able to see that. Lee Jackson from Right at Home said it was a fabulous discussion. Cindy Cardwell agreed and said it was quite a hard topic, so well done. Kathy Makarsky also said it was interesting, and awesome job to Justine and to Cecily. And I want to say to Roberta also for being our moderator, as always, wonderful job. We are just about out of time. I do see some more hands up. So I know that there's, more to talk about. Y'all are welcome to stay on the on the call if you like, and we'll just take some more questions. Thanks, everybody. I hope you have
Thank you, Cecily, and thank you, Justine. And I actually have a neighbor across the street who is having a hypertensive crisis. So I'm going to grab my bag and go over to them. And thank you, everybody. This was great. Thank you so much.
Okay, there goes Nurse Kaufman running to the rescue. Yay, God bless you.
That's what I do.
Mary, I saw your hand up.
Yeah, just want to say hello, Cicely. I'm a Whitster, love the program. And the management style plays an important role on retention. If you have a manager and you're doing, I'll just say home health aid, and that is not your thing, but you are great on the telephone, then there needs to be some cross training and moving you to a place that's a better fit. And we had a boss that found that he did a person an injustice in putting him in a position that he was not suited for in management, and he had to let him go. But when there was an opportunity to bring him back in a role that was more suitable for him, he made sure that the job posting never happened, and he reached out personally to bring that person back into a role that he should have been in to begin with. So we have to be mindful not to set people up to fail.
Thank you for the question and for the comment, Mary. And do you want to respond, Cecily?
You're on mute, Cecily. We can't hear you.
Cecily's frozen now, so her connection went down.
Okay, I'm back. I'm sorry.
Okay.
I'm back.
Yeah, still frozen, Cecily.
She was back for about a minute.
I know it popped in. She can hear what we're saying, but she's not able to respond. Justine, did you want to respond also to Mary?
I'm really unfamiliar with the situation.
Sometimes if I stop the video and stuff, I'm sorry.
There you go.
Okay, I apologize. I was just going to say that, no. Am I here?
Yeah.
Yes, we can hear you.
We hear you.
I was just going to say, yeah, Mary, when I heard the voice, I'm like, I do know Mary. So definitely love to hear you and see you as well. One thing I was thinking too, when it comes to my grandfather, I don't know if this is like a recruitment tool, but I gained so much wealth from my grandfather in regards to the stories that he tells me. So I enjoy the stories. I enjoy learning the history. I enjoy hearing about what he did back in the day or what the family was like back in the day. So I think, if you encourage your employees just to engage in conversation with your clients, that might be a selling point as well, because you can't learn those things just by being on your phone. Like, you have a real life historian in your presence. So I think sometimes, I enjoy those conversations too.
I think when it's your family, it makes it a little bit easier. It's getting someone to enjoy speaking with seniors. I know Mary and I do a lot of things together. I mean, Shalom and I have done, most people here, we've done a lot together. But the stories that we hear, we appreciate those stories. We appreciate the struggle and everything. It's just hard when you have the younger caregiver because they don't really appreciate it. They don't keep things. My big problem is I'm moving, I'm getting rid of stuff, right? But it's a memory for me. And we had a whole generation that did that. That's not the current generation at all. So I think it's hard. You can't teach. You mentioned passion in the beginning. Passion is important, but the empathy and the understanding of what these people are going through.
Right.
That personality test, I definitely would love to get that from Roberta to see if that makes a difference.
She did respond that she will forward it to me, and I'll forward it out to the group. So thank you for that. And I also saw that Laura, before she jumped off, and John, he's still with us, I had requested that as well. So we'll get it out to the group. Anybody else want to have a last comment before we all sign off? Okay, well, thanks, everybody. It was I think fairly hard hitting, but well received. Some good points. Also, about 17 participants for all are part of the call. And have a good afternoon, everybody. We'll see you
Thank
next month.
you, Cicely and Justine. It was good to
Thank
see
you.
you, Cicely.
Thank you so much for having me.
We'll talk.
So glad that y'all could join us.
Bye-bye.
Bye.